Hello guys, welcome back again to my channel. So today we'll be discussing responding to ventilator alarm. Yeah, welcome back. So when the patient is on ventilator, there are different types of alarm that the nurse have to look out for. And what are those type of alarm? You look at the high pressure alarm, the apnea alarm, high respiratory alarm, and the low tidal volume alarm. So this is part one of this teaching today. So we are going to look at the high pressure alarm. What is the cause of this? One of the causes is secretions in the airway. When there's secretion in the airway, it causes the high pressure alarm to go off. Then coughing or biting the tube. When the patient bites the tube or the patient is coughing, it can let the alarm go off. Bronchospasm, kinked or occluded tube. So when the tube is kinked or is occluded, it will make the high pressure alarm to go off. What is the nursing management? As an RN that is on duty, what are you expected to do for the patient that is ventilator alarm is going off on high pressure? So what the nurse does is this. First of all, you sunshine the airway to remove secretions. So secondly, you reassured or sedate the patient. So you reassure or you sedate the patient. If the patient is agitated, you need to sedate the patient. Check the circuit for kinks or water accumulation. Then last and not least, notify the respiratory therapist if bronchospasm is suspected. So with this, we have come to the end of today's program teaching. So please look out for the part 2. In the part 2, we are going to talk about apnea alarm, the cause and the nursing management. Thank you for watching. Here is the part 2. You can click on this link.